One.
Good evening. My name is Heather Hollick, and we are here to do the physical examination on Miss Aubrey Jones. Aubrey is a 12-year-old young lady who weighs 135 pounds, is 5'3". Her other vital signs are heart rate of 82, blood pressure of 94 over 52. Oxygenation saturations are 99% on room air, and her respiration is 18 per minute. All of these were normal findings. Now, Aubrey, my name is Heather, and I'm going to be performing a physical assessment on you. Do you have any areas of questions or concern? Perfect. So the first thing I'm going to do is perform my hand hygiene. And as I'm talking with Aubrey, I'm going to be performing a mental status examination. I can see that this is a 12-year-old Caucasian female who is sitting up in no apparent distress. She appears to be oriented to her surroundings as well to herself. I would say that her orientation is oriented to all. Now, Aubrey, what I'm going to do to begin with is I'm going to start by taking a look at your head. Now, the things that I'm looking for in your head is just to make sure that you have a nice, normal-looking head. We call that normocephalic, and you are normocephalic. I am going to just touch your head. I'm feeling for any lumps, bumps, or any areas of concern. I'm also going to be looking for infestations or scaling of the skin, and I'm not feeling anything. Her hair is soft. Oops, I'm sorry. And her skin is soft. All right, perfect. Now what I'm going to do is I'm going to move on to her eyes. Taking a look at those eyes, I'm going to start with her eyebrows. They are both symmetrical. They are fully formed. Looking at the eye themselves, I'm seeing two round-looking pupils with blue irises. The sclera are both free of any jaundice, and they do not appear to be reddened at all or irritated. She does have a little bit of a dark circle underneath her eyes, but not too bad. Now I'm just going to pull down her eyelids here and take a look. Well, looks beautiful, nice and pink and healthy. All right, Aubrey, now what I'm going to do is I'm going to shine a little light in your eyes. Are you ready? Okay, so the first thing I'm going to do is I'm going to cover one half of her face. Now I'm going to bring this light in, and I'm checking for pupillary reaction. Now, while I bring the light down in this eye, I'm going to look over in her other to see if it is dilating and constricting. And it is. Now I'm going to do the same thing on this other side, Aubrey. Perfect. All right, very good, Aubrey Jones. What I'm going to have you do next is I'm going to have you follow this with your eyes only. And this is assessing for cranial nerves 3, 4, and 6. Her EOMs, or extraocular movements. I'm not seeing any nystagmus or deviations. That all looks really good. Now, Aubrey, what I'm going to have you do is I'm going to have you look right here. I'm going to bring this towards you, and I'm going to bring it back, okay? All right. Now, as you can see, her pupils are constricting when I bring it close and dilating when I bring the object back out. This is a normal finding, and I'm happy to see that. All right, Aubrey. The next thing I'm going to do is I'm going to hold this Snellen eye chart about 14 inches from her face, and I'm going to have her read from left to right. This line for me, if you could cover one eye, please. Okay, thank you.
4, 2, 6, 7, 3, 9.
Perfect. Aubrey, other eye.
4, 2, 6, 7, 3, 9.
Perfect. Aubrey has 20/20 vision. All right. That also will be checking the optic nerve, which is cranial nerve number 2. All right, Aubrey, now what we're going to do is we are going to take a look at your nose. I'm just going to check to make sure that that nose looks nice and symmetrical. It looks like Aubrey's nose has a small deviation there to the left, but this is a normal finding. Now, Aubrey, at any point, I want you to tell me if this is tender. Checking again for any lumps and bumps. You okay? Mm-hmm. Okay, perfect. Now, Aubrey, I'm going to need you to sniff. Perfect, and sniff. Now, Aubrey, have you had any changes in your sense of smell?
No.
No, perfect. That's checking cranial nerve number 1, her olfactory. And I'm also just going to take a look here at the mucosa. It does not look irritated. I'm not seeing any drainage. Looks good. All right, Aubrey, now I'm going to move down to your mouth. So the first thing that I'm going to have you do is I just want you to open up. I want you to say, ah. Now I'm looking for that for the uvula. It's nice and midline. Can you stick your tongue out, please? It's not deviated to either side. Now I'm going to push right here. I want you to push on that with your tongue. Now how about on the other side? All right. Now, open your mouth wide. Push. And, okay, perfect. Now, how about I feel right here? Open your mouth wide. I'm looking for any clicks, locking. No TMJ. Okay, perfect. So in this part, the uvula, as well as the tongue movement, has allowed me to assess for cranial nerves 9, 10, and 12. So we have the glossopharyngeal, we have the vagus nerve, and we have the hypoglossal nerve. So those are all perfectly intact and looking great. Now we're just going to take a look at the overall face. So Aubrey, what I want you to do is lift those eyebrows way up. Wow, scared face. Whoa, okay. Now, could you give me a puffer fish? Blow out those cheeks. Perfect, Aubrey. Now, can you smile for me? Now, this is the facial cranial nerve. Thank you so much, sweetie. As you can tell, what we're looking for there is symmetry. Symmetry is perfect. I'm not seeing any deviation, any ptosis. It looks great. Now, what I'm going to do, Aubrey, is I'm going to have you close your eyes. All right, I want you to tell me what you can feel. Touching? That's the trigeminal nerve, the cranial nerve, and this one is perfectly intact. All right, Aubrey, so the next thing that I'm going to do is I'm going to take a look at your ears. All right, so the first thing that we're going to do is we're going to inspect the outside, make sure everything looks good, especially paying attention to the pinna, which is where we can get cancers, and then pulling the ear forward to make sure we don't have any scaling behind that ear. I don't see any of that on this ear. Now, Aubrey, is it sore at all when I push? How about when I pull? No. Okay. Okay. Now, I'm going to take a look at this ear. Again, paying special attention to the pinna. I'm looking behind the ear, which is perfectly normal. I'm going to push on your tragus. Aubrey, how's that feel? Fine. Okay, how about this? Fine. Right. Now, I'm going to check the lymph nodes, both pre- and post-auricularly. Any tenderness here, Aubrey? All right, any tenderness back here. Now, if I were to feel tenderness in the preauricular area, that would indicate an eye infection. Behind that would indicate possibly an ear infection or a mouth infection. Now, any tenderness in these lymph nodes? No. Okay, these lymph nodes would be an indication of possibly like tonsillitis or having a strep throat. Now, these down here also. How's that feel? Fine. Perfect. So all those lymph nodes are good. Now I'm going to just take a look at her neck and check her trachea, make sure it's nice and in line. And it is. Okay, Aubrey, now what I'm going to do is I'm going to feel the muscles on your neck here. Can you sit up nice and straight for me? Perfect. Any soreness back here? How about right here? All right, it looks nice and symmetric. Actually, it looks like she's kind of enjoying that. Okay, nice and symmetric. No problems. I want you to bring your arms up. Okay, that's checking the spinal accessory cranial nerve. Thank you so much. And that looks to be intact. Also a partial rhomburse. So it's all looking good, Aubrey. Now, let's see here. Aubrey, what I'm going to do is I'm going to check your hearing. And what I'm going to do is I'm going to have you plug your left ear. And I'm going to whisper 3 words to you, and I want you to whisper them back.
Apple, table, science.
Perfect. Let's go over to this other ear. We're going to do the same thing.
Alex, psychovision.
Perfect. Her hearing appears to be intact. There are some other tests that we could do to assess for hearing loss if we saw any differences or abnormalities. We are going to pretend like this is a tuning fork, and what I would do is I would strike it, place the tuning fork in the top of her head. This is known as the Weber's test. Now, what this will do is we can then ask Aubrey, we can say, Aubrey, are you hearing any different sounds in her ears? If she says no, this means that her hearing is normal. That's a good finding. If it lateralizes or she hears a different sound in one side or the other, that could mean bone conduction loss, and we would need to do some further investigation. Another test, which is called the Renee, is again, you would use a tuning fork, you would strike it, you would place the tuning fork on the mastoid process, and then you would ask Aubrey to tell you when she no longer feels the vibration. At that point, you can take the tuning fork and bring it to her ear and say, Aubrey, is it still making noise? And if she says yes, this proves that air conduction is greater than bone conduction, which means that her hearing is intact. And again, you could check on the other side. That would check for any, of course, further hearing loss. So those all look good. I'm going to set this aside now. Okay, Aubrey, what I think I'm going to do now is I'm going to take a look at how you breathe. Okay? So I just want you to breathe normally, okay? What I'm going to do first is I'm going to check the anterior-posterior ratio, which in this case, it should be 2 to 1. So anterior to posterior, we draw a line right between there, this should be twice as long as this. And that looks accurate. Okay, Aubrey, what I'm going to do now is I'm going to come sit up here with you. I'm going to watch you breathe, sweetie. All right. And if I could, go ahead and take a nice deep breath in. Okay, perfect. Let it go. Perfect. Now, what I'm checking for there is to make sure that we have nice chest wall expansion. In this case, we do. All right, Aubrey. I'm also going to take a look at her back. Make sure that those muscles look good. Any tenderness? Mm-hmm. Okay, perfect. I'm going to check for CVA tenderness. Is that sore? Mm-hmm. How about that? That's assessing those kidneys to make sure that we don't have any kidney infections. Okay, so now I'm going to take a listen. If you want to breathe in and out through your mouth, please, Aubrey. If you feel it all faint, you can slow down. Just let me know. All right, Aubrey, thank you so much. Now I'm going to take a listen to the front. Okay. Again, please. Okay, perfect. So it's